Hi, everyone. Dan Eisner here from ZLC Employee Benefit Solutions. My passion is working hard to find better ways for employee benefits by partnering with finance and HR leaders in the market. I also look to leverage my relatively unique profile. I've got more than 20 years of experience as an employee benefits advisor, and I have the skills as the only chartered professional accountant working in this industry in the local market. It's this passion that drove me to develop this Better Benefits podcast series, and thanks for joining me today for another episode. I'd like to talk about a double edged sword when it comes to obesity and employee benefits plans. Whether you support employees with coverage for weight loss drugs or not, it's going to cost the plan. And that's a real dilemma. So, how do you deal with that? As always, I'm going to give you my thoughts, but I'm really interested to know what you think. Also, if you like what you hear and want to learn more, be sure to hit the like button or follow me on my LinkedIn business page to be notified about other podcasts to come. So let's get started. As I said, employee benefits plan sponsors are faced with a real dilemma here when it comes to obesity. This chronic disease drives higher premium costs due to one, broad-based drug plan utilization for multiple conditions, two, increased use of other medical services and supplies, three, higher risk of reduced productivity and absenteeism, and lastly, the risk of deteriorating mental health. There are emerging new therapies available, particularly around a new class of drugs that you've heard of like Ozempic, Wegovy, stay tuned for a new one, Mounjaro. And these drugs provide promising results for weight loss, but the therapies would also cost more money for group benefit plan sponsors in the short term. So what is a plan sponsor to do? Let's look at the data again. Canadians are less healthy than they have ever been, with an increasing proportion being overweight, obese, or morbidly obese. So the most recent stats I have available from Stats Canada are 2018, and then 26.8% of Canadians aged 18 and over were classified as obese, and another 36.3% is overweight, bringing the total population with increased health risks due to excess weight to over 63%. Realistically, this situation hasn't gotten any better since 2018, and it's not likely to change anytime soon. Healthcare practitioners and the general public can and should agree that there's a direct link between obesity and other health risks, including but not limited to diabetes, heart disease, including blood pressure and cholesterol, stroke, chronic pain, some cancers, and even anxiety and depression. There's been broader interest in using these new prescription drugs to help with weight loss, even though some of these drugs may have been developed primarily for the treatment of diabetes. However, few employee benefit plan sponsors currently provide coverage for weight loss drugs. According to the TELUS Health retrospective 2022 report on drug trends and national benchmarks, less than 5% of plans in Canada currently cover weight loss drugs, which is coincidentally very similar to coverage for things like fertility drugs and sexual dysfunction drugs. Unfortunately, all these drugs have usually been classified by many people as lifestyle drugs, and thus coverage has been less readily provided by group benefit plan sponsors. This mislabeling as lifestyle drugs can be potentially dangerous and unfair. We really need to ask ourselves whether individuals consciously decided to gain weight or become obese. Given that obesity is medically recognized as a chronic disease, why do we view it as a lifestyle decision? It's important to note that we don't apply this reasoning to many other diseases where lifestyle choices could have also contributed to the condition. Things like type 2 diabetes, cardiovascular diseases, and even some cancers. So are we actually being guilty of weight bias, or are we creating a stigma for overweight and obese people? So let's try to be a bit more positive and note that the sooner we agree that obesity is a chronic disease that adversely impacts our employees and thus our businesses, the sooner we can get on with looking for treatments and solutions. Additionally, the issues surrounding obese and overweight employees dovetails quite nicely into two other current trends in HR. Firstly, we all know that there's a heightened focus on employee health and well-being. So does it not make sense to support obese and overweight employees in their efforts to lose weight and improve their overall health and well-being? Secondly, as you've likely been seeing a lot in the market or in your own organization already, there's also a growing focus on diversity, equity, and inclusion initiatives. So, does it not make sense to address the needs of approximately two-thirds of your employee population around weight loss? Might employees be more interested in pursuing weight loss initiatives if they feel supported by their employer under both the well-being and DEI banners? The risks related to obesity are significant to businesses, and therefore the opportunities related to providing weight loss coverage are also significant. How do you balance the idea of promoting and investing in employee health and well-being as compared to the higher cost of these new weight loss drugs? Businesses need to recognize that obesity is going to cost them either way. So employee benefits plan sponsors are at a critical crossroad. If they do not cover weight loss drugs, the benefits plan utilization in all these other areas is going to continue to rise and drive up premium rates in the short and long term. If plan sponsors do decide to cover weight loss drugs, the benefits plan costs will definitely rise in the short term because of that coverage, but there's also the potential for them to come down in the mid to long term, along with providing higher productivity in the business and improved mental health and well being. Ultimately, the choice is yours as an employee benefits plan sponsor. Okay, now that you've heard my thoughts and opinions, let me know what you think. As always, I really want to know whether this advice was helpful. Also, how does it compare to what you're hearing from your current advisor or other advisors in the market? I always want to know if there are other current topics that you'd like to see me cover in future podcasts. Let me know what's bothering you or keeping you awake at night with respect to your employee benefits plans. Thanks again for joining me. Be sure to follow me on my LinkedIn business page, which is Dan Eisner, Employee Benefits Advisor. Also, you can subscribe to my YouTube channel for notifications on the next Better Benefits podcast. All that information will come up on the screen in a second. Thanks so much.